Because I practice general dermatology as well as cosmetics, a lot of my patients come in for growths and lesions on their body. Once I diagnose them to be benign, then oftentimes patients request to get them removed.
One of the most common types of skin lesions that patients will present with are sebaceous hyperplasia, which is a dilated oil gland in the skin.
I noticed I was developing a couple of spots on my face. They were small spots that looked like tiny donuts, and a little self-conscious about them.
A lot of the patients that present to us have had, say, warts for years. I'm talking 15 years, 20 years, and I'm seeing the same patients come every 4 weeks to treat their wart that is just not resolving.
And these recalcitrant warts are very difficult to treat. And it's amazing the visceral reaction people have to these warts. They hate them.
My wart did bother me. Say going to get a pedicure, trying on shoes at the store, just anytime someone else might see it, touch it, anything like that, I was a little self-conscious of it.
We currently have liquid nitrogen and we have electrodesiccation, but the limitations of those is that we are not able to get to the root of the issue. And so for us to treat a benign lesion, it would be ideal to have something where we were able to remove the entire cellular component.
So I had this sebaceous hyperplasia. It did look like a pimple. It was very unsightly, something that was not able to be covered up with makeup. So when I went to the doctor and they told me that the CellFX was an option, I was very excited.
CellFX uses nanopulse stimulation, and pretty much what it is doing is it's targeting the cellular component of a benign lesion, such as a wart or a sebaceous hyperplasia.
For our patients, it's important to know that this is a treatment that's different than what they may have seen or experienced previously. And the way that it's different is we have small pairs of electrodes that are inserted into the skin. And an electrical impulse is bounced back and forth between those two electrodes, or pairs of electrodes.
There's a little electrical pulse that happens, and sometimes you can feel just some pressure, sometimes a little light twitching feeling, a couple seconds, and then it's over.
Nanopulse technology is unique. It does things that I've seen nothing else do. Where can I go in and take a flesh-colored lesion off and leave almost normal skin?
We typically numb the area so that it's comfortable, so it's a pinch, then you don't really feel anything after that.
The healing after CellFX, my foot was sore for a little bit, just a few days, maybe just a little tender. Within a few weeks, it was completely healed up and the spot was gone.
After one treatment of CellFX on my temple, it is totally gone. You can't even tell where it was at all. It's really wonderful.
That's why we're really excited about CellFX, because it can offer treatment for a benign skin lesion without leaving a scar or a mark or any remnant.
I look at patients with warts I've been treating for 3 to 4 years. They come in, I do nanopulse technology on them. You should see their eyes when they come back, the smiles on their face when they come back.
I've had one gentleman send it was life-changing. He was over the moon.
My expectations for the CellFX were definitely exceeded.
I would definitely recommend CellFX to friends and family.
I think something like CellFX is a great option for patients, because now they get to decide, do they want to have their hard-earned dollars go toward a treatment that will achieve results in as little as 1, sometimes 2 sessions. So CellFX really represents a highly efficient treatment option for our patients that will ultimately save them time and money.
The nanopulse technology by CellFX is really new, and so I'm really looking forward to their trajectory and what they have as far as their impact in dermatology.